Dr. Melissa Keogh is a psychologist and family expert and believes that parents must perfect the art of us time.
So we really do have to prioritise the couple relationship. That can be easier said than done, but my tip is don't just spend time individually on your own me time. So make couple time as well. Go out together, do new things especially is really good. Just do something and just have fun together.
Please welcome Dr. Melissa Keogh from Psychologist.
Christmas is a really stressful time. Tensions are quite high for lots of different reasons. So my tips are really to, if you need to speak up about something, try and do it assertively. That's really the key. People have a lot of issues, particularly around traditions, I think. Who's doing what for lunch, who's not there, who's coming. That's when things get a little bit sort of testy. So I guess psychologically we talk about some techniques for that. Dad, look, you know, there's something that's on my mind about Christmas lunch. It involves the two of us. Can we just have a chat about it? That's a soft start-up. Then there are actually the kind of the nitty-gritty and the how-to of assertiveness. So there's kind of a four-step process that we use. Yeah.
I've got Dr. Melissa Keogh, a clinical psychologist on the line. Doctor, tell us, how do we get ourselves out of a bad mood other than stuffing our face full of chocolate?
Don't do that, Dave. Don't do that for too long. That's not going to be helpful.
All right. Well.
As tempting as that is, I would suggest, I think the first thing really is just to keep in mind that this mood and your feelings are temporary, because feelings will come and they will go, so they're going to pass. So don't get too hooked on the fact that you're in a bad mood and it's going to be like this forever, because it won't be that way.
Please welcome Dr. Melissa Keogh from kidspot.com.au. Welcome, Melissa. So what then makes women perhaps go off sex a little bit after a baby's born?
Well, there are a whole range of factors. Some of them are physical and some of them are psychological. Probably the main one is fatigue. When you look at the research and you ask mums, overwhelmingly, it's tiredness. 6 weeks isn't actually the norm. When you look at the research, 85% of people have re-engaged in sex by the 3-month mark. 25% of those have done so within 6 weeks, but no, most people by about 3 months. But even then, some people take a lot longer.
See someone, maybe a sex therapist, or to talk about it? Because it seems like it would be an important thing to get, figured out.
I wouldn't leave these things too long. Yeah, I would. Being a psychologist, I do recommend people go and talk about their issues sooner rather than later, because if you start to disconnect emotionally and sexually, problems will arise in the relationship. I think the most important thing is to stay connected with each other.